Go.
Okay, so impression procedure. I'm gonna hand hygiene, and then I'm gonna place my barriers. Okay, so one headrest cover over top the headrest. One big barrier for the back tray table. Ripping it down the seam. And it covers everything. We're not going to use any of those hoses or anything like that. We will make sure it's covering. And then two of the tray sleeves. Two tray sleeves. One is going to go over the tray that the impression goes into after we take it out of the patient's mouth. Okay, that goes on your tray table over here because it's going to go from the patient's mouth into there. And then the other one, we want to just rip the corner here because it's going to go over our bottle. So we're going to rip off this little corner over top and then line that up. There we go, so we can spray that. Okay, I have my barriers on. I'm gonna go get my tray. My tray is here. Just clean hands. When I'm walking by, I'm gonna grab my two baggies that my impressions are gonna go in. This comes over. Put the patient napkin here. Goggles here. Tray goes on the back counter. Baggies you want to set and kind of open up because the outside of the baggie is going to stay clean. So I'm going to set them up so that I don't have to touch them later. Just like that. Then I'm going to grab a couple paper towels. I'm going to put a couple on the patient tray and a couple on my back counter to clean my bowl later. So these are for the patient. These go here. Okay, I'm all good. My patient comes in, my patient is seated. Now I'm gonna get ready to take the impressions. So I have to don the rest of my PPE. Glasses, I don't have my glasses. I'm gonna borrow these and let's go get another pair for the patient. There we go. All right, there we go. We're good. And then I'm gonna hand hygiene. Gloves on because I'm gonna put my hands in the patient's mouth. Gloves on. Gloves on. Okay, so now we're ready to take our patient's impressions, okay? So here we go. I take the impression, comes out of the mouth, goes in the tray. I take the impression, comes out of the mouth, goes in the tray. My assistant is going to release Johnny to leave. Bye, Johnny. Okay, here I am, still with my gloves on. I'm going to take my tray over to the sink. You're gonna rinse out the impression. Make sure you're holding it down. You don't wanna hold it straight up so everything flies out. You wanna hold it down. We're trying to get all that debris out of there. Those Cheetos, those Oreos. Rinsing everything off. Now I'm gonna put it on the other side of my tray here. Rinsing it down. Now, let's talk about what if this sink was being used and I need to come to this sink. There's no foot pedal. So I'm going to use a paper towel to turn the sink on. Then I'm going to rinse. Okay, when I'm done, I'm going to turn it off. Okay, I come back over. These are still contaminated, so they go back on my tray table. This is my clean area. Okay, so I'm going to pick up my impression and I'm going to saturate it all over. Don't spray your finger, just saturate it all over. Then we're gonna come over, upside down in the baggie, get that handle, get it in there. You're gonna touch these later with no gloves, so don't be shy. Next one. Get it all in those teeth. If you see how I'm getting it all where it's running in those grooves of where the teeth are there. Get it all over. Shake it off. Come over in the baggie. Spray it, don't be shy. Okay, this is gonna be clean here, okay? I'm just gonna go ahead and grab this off of there because I'm done with taking care of those impressions. So now I'm gonna take down my barriers. Okay, this tray has a barrier on it, it's not been broken, so I'm just gonna slide it out onto the clean side. Okay, headrest cover. All these goodies are going onto my tray. Paper towels away. Pick up my tray, fold this in. You don't want to pick this up because there's going to be alginate or impression material everywhere and it's going to fly. So you want to kind of just fold it in. Throw that away. Now I'm going to go drop my tray in sterilization. Okay. All the way into sterilization. Into the rack. Into the rack. Gloves off. Hand hygiene. Now, I'm going to close my bags. And I want to make sure that it's all in that liquid to make sure that it's getting disinfected. Remember, we're going to touch them later with no gloves. So see, I'm only touching the outside of the bag. Okay? Now after I've done that, now I'm going to put on my utility gloves. And now I'm going to disinfect my room. Okay, so I need to just wipe here. Here, you don't need to wipe the whole pool. There was nothing happening. We're just going to wipe right here. Then we're going to do the chair. The arm and the chair. Make sure we got that good. We don't have to do here because it had a barrier. We don't have to do here because it had a barrier. That's the first wipe. Second wipe. I'm just going to pull one extra out of here and leave it right there. Okay, here's my second wipe. Okay, good. Take these, wipe these gloves off. Make sure there's no debris all over that. And then this one I have out is going to disinfect my glove. There we go.